How can you classify deep cervical fascia?
Investing layer of deep cervical fascia, pretracheal fascia, prevertebral fascia, carotid sheath.
What are the structures enclosed by carotid sheath?
Common and internal carotid arteries, internal jugular vein, vagus nerve, and deep cervical lymph nodes.
How can you classify lymph nodes of the neck?
Horizontal lymph nodes such as submental, submandibular, preauricular, mastoid, and suboccipital lymph nodes drain superficial tissues of head and neck. Vertical lymph nodes drain deep structures of head and neck. They are deep cervical nodes along the internal jugular vein, superficial cervical nodes along the external jugular vein, infrahyoid nodes, prelaryngeal nodes, prepharyngeal, parapharyngeal, and retropharyngeal nodes.
What is the commonest swelling to encounter in the neck?
Swelling of jugular digastric lymph node.
Where does that lymph node lie?
At the junction of internal jugular and common facial vein.
When does it enlarge?
In tonsillitis.
Why thyroid swellings move upward during swallowing?
Pretracheal fascia that surrounds thyroid gland has attachments to trachea and laryngeal cartilages. During the second phase of swallowing, trachea and larynx ascend. So, thyroid gland within the pretracheal fascia also move upwards.
What are the inferior attachments of investing layer of deep cervical fascia?
It is attached to sternal notch on each side to upper surface of the clavicle, acromion, and spines of scapula to posterior midline.
Identify the clavicle.
This is the clavicle.
Describe it.
This is the clavicle and this is the lateral end of the clavicle. It is flat and it articulates with the acromion process of the scapula. This is the medial end of the clavicle. It is larger than the lateral end and it articulates with the sternum. It is quadrilateral. And this is the shaft of the clavicle. It is slightly curved and the medial two-thirds of the clavicle is convex forward and the lateral one-third of the clavicle is concave forward. This is the superior surface of the clavicle. It is smoother than the inferior surface and this is the inferior surface of the clavicle. There is a groove for the subclavius muscle and this is for there is an impression for the costoclavicular ligament and this is the conoid tubercle and this is the trapezoid line. Conoid tubercle is for the conoid part of the coracoclavicular ligament and trapezoid line is for the trapezoid part of the coracoclavicular ligament. And the muscle attachment of the clavicle are the sternocleidomastoid muscle attaches here. The pectoralis major muscle attaches to this area and subclavius muscle attaches to this area. The deltoid muscle attaches to this area and the trapezius muscle attaches to this area.
What are the superior attachments of investing layer of deep fascia?
It attaches to entire length of the lower board of the mandible, external protuberance in posterior midline, the mastoid process and superior nuchal lines on either side. In the interval between angle of the mouth, it encloses parotid gland as parotid fascia.
What fascia continues as axillary sheath?
Prevertebral fascia.
What are the boundaries of axillary inlet?
Lateral border of first rib, superior border of scapula, and posterior border of clavicle.
Get the first rib and describe it, showing its related nerves, muscles and vessels.
This is the first rib. This is the anterior end of the first rib. It is large and thick. And this is the posterior end of the first rib. And it has a small rounded head and a neck. And this is the tubercle of the first rib. It is large. And this is the shaft of the first rib. The shaft has a superior surface and an inferior surface, and an inner border which is concave and outer border which is convex. There is a prominent tubercle on the inner border. This is the scalene tubercle. It is for the attachment of the scalenus anterior muscle. And in front of this tubercle, the subclavian vein crosses the first rib, and behind this there is a groove. It is named as subclavian groove. The subclavian artery and lower trunk of the brachial plexus lie in relation to the bone.